Did you know that just one small magnesium pill before bed, something many people take to relax, could actually make your heart stop, drop your blood pressure dangerously low, or even cancel out the effect of your medications? It sounds scary, but it's a reality most people are never warned about. Magnesium is essential, but not for everyone. In fact, there are 6 groups of people who should absolutely avoid it, because for them, magnesium isn't a miracle mineral, it's a double-edged sword. In today's video, I'll explain who should take it, who shouldn't, and how to use it safely to protect your heart, kidneys, and nervous system. Stay with me until the end, because even one small detail you overlook could mean the difference between being healthy and being in danger. 1. If your heartbeat is already slow, be very cautious. I'm not saying this to scare you. I'm saying it because I've seen too many people end up in the ER from a tiny supplement they thought was harmless. I still remember one of my patients, Frank, 75. He ate well, walked every morning, and took care of himself. One day he read online that magnesium helps you sleep and relax your muscles. Sounded great, right? So he started taking 1 capsule before bed. 3 days later, he called me, "Doctor, I feel weak, dizzy, and my heartbeat feels slow." When I checked, his pulse was only 42 beats per minute, dangerously low. The culprit, magnesium. It relaxes muscles, including the heart, and can slow down the electrical signals that keep your heart beating. So, if you have bradycardia, a slow heartbeat, or any type of arrhythmia, remember this: magnesium is not the harmless natural sleep aid you see in ads. Before you take any form of it, talk to your cardiologist. Even a small dose could briefly stop your heart, and sometimes that brief moment can be fatal. 2. If you have kidney problems, magnesium can be far more dangerous than you think. I know it sounds surprising. Magnesium is often advertised as heart-healthy, relaxing, and great for sleep. But I'll never forget one of my patients, Margaret, 72, who learned this the hard way. She had mild constipation and read that magnesium works as a natural laxative. Without consulting a doctor, she started taking 1 pill every night. At first, everything seemed fine. But a few days later, she began feeling nauseous, weak, and noticed her arms and legs felt unusually heavy. Her daughter brought her to the hospital, and we found her magnesium level was twice the safe limit. Because her kidneys were already weak, they couldn't filter out the excess magnesium. It built up in her blood, lowering her blood pressure, slowing her heart rhythm, and putting her at risk of cardiac arrest. She needed emergency IV therapy and dialysis for almost a week. That's why I always emphasize, if you have chronic kidney disease or reduced kidney function, never take magnesium without your doctor's supervision. For a healthy person, it's a helpful nutrient, but for someone with kidney issues, it can quietly turn toxic. 3. If your blood pressure tends to run low, magnesium might make it worse. Many people hear that magnesium helps relax blood vessels and lower blood pressure, and that's true for people with high blood pressure. But if your blood pressure is already on the lower side, magnesium can drop it even further, and that's where the danger begins. I remember Robert, 69, a cheerful, active man who just wanted relief from leg cramps at night. He bought a magnesium supplement online and started taking it. 3 days later, he stood up from breakfast and the world went black. He barely caught himself on the kitchen counter before collapsing. When I examined him, his blood pressure was 85/55, so low it could have caused fainting or a fall. Magnesium widens blood vessels, which improves circulation, but also reduces vascular pressure. For someone with low blood pressure, that means less blood to the brain, leading to dizziness, fainting, or sudden collapse. If you often feel lightheaded, see stars when you stand up, or know your BP runs low, Don't take magnesium just because someone said it's good for the heart. For you, it might not be calming. It might be the last drop that pushes your heart and blood pressure into danger. 4. If you take daily medications, be very careful. Many people assume magnesium is natural, so it must be safe. But this natural mineral can block your medications from working or even create dangerous interactions. Take Linda, 68, for example. She was on antibiotics for a urinary tract infection. After a full week, she wasn't getting better. She told me, "Doctor, I didn't miss a single pill." When I asked what else she was taking, she said, "Just a magnesium supplement in the morning for energy." That was the problem. Magnesium binds with certain antibiotics in the stomach, preventing absorption, meaning the medicine never reached her bloodstream. And it's not just antibiotics. Heart medications, diuretics, muscle relaxants, and even some high-dose vitamins can interact strongly with magnesium. Taking them too close together can slow your heart, lower your blood pressure too much, or make your medication less effective. So remember this simple rule: magnesium is not harmless. If you're on daily medication, ask your doctor or pharmacist first. A 5-minute conversation could save you from weeks in the hospital. 5. If you're taking daily calcium supplements, you must pay attention to magnesium balance. Many people over 50 are told to take calcium for bone strength. That's good advice, but only half the story. Your body doesn't process nutrients in isolation. Calcium and magnesium are partners, and when they're out of balance, they can turn against you. I once treated a woman in her 60s who took calcium faithfully every day for 3 years, but never magnesium. Eventually, she developed back pain and burning urination. An ultrasound revealed small kidney stones. Too much calcium and too little magnesium caused it. Without enough magnesium, calcium isn't directed where it belongs. It starts settling in the kidneys, blood vessels, even the heart. Magnesium keeps calcium doing its job, building bones instead of blocking arteries. So if you take high-dose calcium but haven't discussed magnesium with your doctor, pause and check. Sometimes what we believe is protecting us is quietly causing harm. 6. If you have thyroid problems or Addison's disease, magnesium requires extreme caution. I know these conditions already make life exhausting. Fatigue, low energy, constant weakness. So when someone says magnesium boosts energy and reduces fatigue, it's tempting to try. But for people with thyroid or adrenal issues, magnesium can disrupt your electrolyte balance, something your glands already struggle to maintain. Even a small excess can cause severe drops in blood pressure, muscle weakness, or extreme exhaustion. One of my patients, a 65-year-old woman with mild hypothyroidism, said magnesium helped her sleep. But after a few weeks, she felt dizzy, weak, and short of breath. Tests showed her electrolytes were completely imbalanced. If you're taking thyroid medication or managing Addison's disease, talk to your endocrinologist before adding any mineral supplement. Magnesium isn't bad, but in a body already out of balance, even good things can become dangerous. Magnesium isn't evil, but it's not for everyone. After years as a doctor, I've learned this: the real danger isn't the supplement, it's the belief that more is always better. Magnesium can be wonderful if your body truly needs it. For some, it improves sleep, calms nerves, and stabilizes blood pressure. For others, it can quietly trigger heart, kidney, or blood pressure problems. If you suspect you might fall into one of these groups, don't worry. Knowledge gives you power. Once you understand your body, you can manage everything safely. And if you're wondering, so who actually should take magnesium? What are the clear signs your body is lacking? Stay tuned for the next video where I'll reveal the 7 key signs of magnesium deficiency and how to supplement safely without risks. Thank you for watching. If you found this video helpful, please share it with loved ones and subscribe for more science-based health advice. Let's continue this journey together to live healthy, strong, and peaceful after 60.